Wash your hands, put your gloves on, and get your supplies, okay?
Like especially nursing homes like that, with a bunch of females, that might not work. It's easy though.
Set up your supplies. Because normally you would be doing it on the bedside table. So you set up your bedside table. Let's do it like this. And you doing dent or teeth? Which one y'all doing?
Teeth right now.
Teeth care. So you set it up. All right. One to let him sip and swish, and one to rinse. So I'm gonna show y'all real quick. Step aside for me, Ciara. So when you get ready to brush their teeth, you're going to, first thing you're gonna do is you're gonna dip your brush. Now the first time you can dip it, you're gonna dip your brush, because when you dip it, what are you doing? Rinsing it. Because most people don't rinse these toothbrushes. Once you rinse it, you put your toothpaste on, and then you're gonna have them clench your teeth. Clench your teeth. And you're gonna brush, making sure you're getting the gum line, getting the back, the bottom, come out, let him swish and spit. Now, you don't do it like this, you'll fail. That's the reason this is like this. So you'll do it like that, okay? Then you let him spit again. Then you're going to rinse a little bit, put a little bit more toothpaste, and go over the second time. Clench your teeth, Mr. Abdul, and you're gonna get the back of his upper, just like you would brush your teeth, right? Making sure you get the gum line, right? All right, let me see. Now, once you come out, you let him do what? You let him swish and spit. Then you rinse your toothbrush again. Get some more toothpaste. Stick your tongue out for me, Mr. Abdul. Stick your tongue out. I'm not gonna touch you with this thing. Stick your tongue out. So you tell them to stick their tongue out. So when you stick your tongue out, I'm not gonna touch you with this. I'm not gonna touch you with this. You see how I'm doing that brush?
Yeah.
Dirty to clean, dirty to clean, dirty to clean. Okay? Then you rinse again, put some more toothpaste, and you go over it again. Dirty to clean, dirty to clean, dirty to clean. Okay? You let him swish
And do what now?
and spit. Now, in between each time that you let him swish and spit, you're going to wipe his mouth. Okay? And then once you're done, you're going to put all of this away. And you're going to ask him, is there anything else you need? No? So you're going to put all of this stuff away. You go in, you're going to wash your hands. Take off your gloves and wash your hands. Then you come back and realize, oh, I forgot the barrier. Okay? You don't have to panic. You unhook the barrier because it's not contaminated back here, right? So you unhook the barrier like this, and then you take it, see how my hands are? And you roll it, keeping it away from your contamination. Once you do that, you do this, and you are done. But you're normally going to take it off before you go to dispose of all of this. You take off the barrier, and then you go dispose of everything, okay? But if you happen to forget it, you don't have to panic. All you got to do is what? What is it, Jessica?
Swish and spit.
What is it? Take off the barrier, and you don't touch it. You put your hands underneath it, and you roll it. Okay, see, and you done. All right, same concept with the dentures. You're gonna brush the dentures. The only difference is between the dentures and the teeth is that you get to take these teeth out. Okay, that's the only difference. And you don't use what on these?
Toothpaste.
No way.
So,
Hot water.
Oh, okay.
Okay.
Because remember, I told y'all, if you get denture care, they're gonna set the denture up at the sink because they wanna see what water you gonna use. All right, once you clean the dentures, if you're gonna do denture care, the first thing you wanna do is clean this cup, okay? Now, why is it you wanna clean this cup? Because this cup is gonna take the place of that stupid towel in the sink. That's I don't know who wrote that book, but she's stupid. Now in your book, and it tells you on your checklist to put that towel in that sink and then clean the dentures. And then when you're done cleaning the dentures, then you're supposed to put the dentures in on that towel. Make sense? Not at all. Because now you're gonna watch, that makes no sense. But that's the way it's telling you to do it.
So is that how the test is gonna test us?
Everybody that does that, all of our students that have done this has not failed. All right, because it makes, yeah, I'm gonna go over it again. So the first thing you do when you're doing denture care is you wanna clean that denture cup. And you want to use soap and hot water on this because that polydent and that denture stuff they use leaves a film. Sometimes you won't see it. Now, if you see that film on there, that means they ain't washed that cup in days. But you won't see it, but you can feel it. So you want to wash this cup with soap and hot water, dry it out. Once you're done with this, both of them, you sit them to the side. Then you get the dentures. Let's set this over here. Once you get the dentures, you're gonna get your dentures. Where's my brush? Because like I said, this part won't even be set up for you guys. It'll be set up, but it'll be set up at the sink. So you're gonna have this at the sink. It's gonna be just like this. All right, so you're gonna have it just like this at the sink. You're not even gonna have this. You're not gonna have none of this. It's gonna be set up just like this at the sink. All right, and what she wanna see you do, she's gonna wanna see you put that towel down. But most of them know when you wash this cup, that takes the place of that towel. So the first thing you do is take your dentures out, place them. Don't put them on the sink. You get a paper towel. Put your dentures on the barrier. Because remember, they considered what? Contaminated. So you put them on a barrier. You wash this cup. Then you put this cup to the side. Then you turn on temperature water. Room temperature. Warm water. More cold than warm. Then you're going to use this one to get all of the little crevices. This one for the actual teeth. Okay, then you're gonna rinse it, put that down, rinse it, dry it, I'm just gonna use this, dry it, and place it back in the cup.
I mean, you put toothpaste on this one, right?
Yeah,
Okay.
you're always gonna use, but remember, we say toothpaste, but they usually use like the polydent and stuff. So they're probably, I don't know what they use, but I'll use the toothpaste. You put your toothpaste on, and what side cleans what?
The long side cleans the teeth.
The wide side cleans the teeth. The narrow side cleans all of the crevices. Okay? Once you're done with that, you rinse them. What do you rinse them under? Hot water?
Room temperature.
Okay, once you rinse them, then you do what? Dry them, place them back in, and then once you do that, she's gonna bring you over to the student who's set up. And this setup is gonna be, put that back over there. Then when you get to the student, the setup is gonna be like this. This is all gone away. And then you see you got another toothpaste, right? So now your setup is like this. You have 4 of these swabs. 2 for the gums and 2 for the tongue. Because do you brush your teeth one time? Would you brush your resident's teeth one time? Yeah, at least do it twice. So, with these, your dentures is good. Now, you're gonna dip this in the water, get your toothpaste, and then you're gonna get the upper gums. See the upper gums, the bottom gums, and both of the cheeks. And then you're gonna come out, put that one to the side, dip again, put your toothpaste, repeat the same. What are we getting?
Cross up, down.
Upper,
Lower,
bottom,
bottom,
and both sides of the cheeks. Now, tell me what I did wrong.
No communication.
I ain't never communicating with you. What did I do wrong? In between, especially with your dentures, not so much with your toothpaste, but with your dentures, or teeth care, with your dentures, you want come out, swish your spit. Go back in, what are you getting?
All of that.
Upper gums,
bottom,
bottom gums,
side cheeks.
and both of the cheeks. And then you let them do what?
Swish and spit.
How are you supposed to do this? Is it like this?
No?
Because if she see you do this, she gonna fail you. That's what this is specifically for. Then you do what? Swish and spit. And then you do what?
Wipe it off.
You wipe his mouth. All right? And then you want to repeat the same thing. Dip, toothpaste, stick your tongue out. That's what you're going to tell them. Stick your tongue out.
Be true. Alright, this is compromising them.
I hope that they don't give you teeth care.
I hope they don't, honestly.
Let me tell y'all something. If you refuse a skill, you failed. Okay? If you refuse a skill, you have failed. Because what you telling that's evaluated, you don't know it. And one of my old stupid students, you see I called her stupid? Told that lady she wasn't gonna do foot care, then called me that night crying because that lady failed her. Common sense should have told you. You refuse a skill, you gonna get failed. Miss Renita, I said, what did you tell that lady? I'm not gonna do this. Y'all see what telling us what you not gonna do gonna get you, right? Now she gotta retest again, pay that money again. So don't refuse a skill, okay?
So when you retest, does that mean you gotta take the class and then pay the money?
You could just pay again
You
and
gotta
go.
pay again
For the test,
for the test,
not the class?
not the class.
I mean, I'm not gonna fail, but like, how long you gotta wait if you do fail?
No waiting.
You don't have to wait that long.
Yeah.
You take the next day?
If you feel like you're confident enough to take it, yeah.
I ain't gonna fail.
But they want you gotta schedule it for whenever they schedule it. All right, so stick your tongue out. I am not gonna touch y'all with this stuff. I use this stuff every day. I know this stuff is contaminated, but I'm telling you what you have to say, okay, during the test. So stick your tongue out. He sticks his tongue out, and it's the same concept. What is it? Dirty to clean. You see, I want y'all to see that I'm actually rolling this. So dirty to clean, dirty to clean, dirty to clean. And then you let him do what?
Swish and spit.
And then you do what?
Wipe his mouth.
Let him dry. Then you do it again. Dip.
With.
What is this?
With.
Toothpaste and
Clean.
dirty to clean. And you have to roll it, okay? If you just do this, she ain't gonna give you no points. You gotta roll it. So that's why I'm saying dirty to clean, dirty to clean, dirty to clean, okay? Then you let him do what?
Swish and spit. Wipe off his mouth with tooth.
Okay?
Oh,
Wipe off his mouth, and then you're done. Now you're all done. Get all your supplies. I still got my gloves on, so I can take off this. Make sure that he's set up. Are you good, Mr. Abdul? Where's your call light? He got his call light. His railings in up. So all you gotta do is go dispose of all of this. And give him his dentures. These are gonna be on his table anyway.
Okay, so you don't do it, he does it.
Yeah, we don't put their dentures in.
Okay.
Because you can scratch them and cut that's another thing you don't floss. You don't floss either.
Do we rinse the dentures under the sink? Or like, do we put like in a cup or something?
No, you're gonna actually have the dentures out. Get your toothpaste, and you're gonna be under the sink, under the water, cleaning the dentures. Okay? And she's gonna purposely test that water just to see how wet. Now, one thing I did skip for you, let me go back and tell y'all. Once you are done with after you've done cleaning this, put some water in it, and then put your dentures in it, because you don't want your dentures to dry out. Okay? So put some cold water in it, put your dentures back in it, and then set it next to your patient. Now, what you can say is, do you want to put them back in, or do you want to sit them on the table? 9 times out of 10, they sit them on the table and wait till breakfast comes. Okay? All right. And that is your denture and your teeth care.
Like, do we completely submerge it in water before we put it over there?
What?
Like the dentures.
Yeah. This is how she expects it to be. That's why I keep this. See that?
Okay.
All right.
Let me get some water.
Now, they're gonna be like this. She does this on purpose because she want to see, are you gonna clean them? Because they in this solution, are you gonna clean them? Most people just take them out, rinse them, and put them back in. Now, did they clean them? Don't throw up there, Jessica. Jessica was like, Yeah. All right. So, what time is it? All right, everybody, get back to practicing.